Hello class, my name is Samuel Vitebskiy and today I will be talking about renal cancer. What is the renal system? The renal system or the urinary system is a system that filters blood and creates urine as a waste byproduct, and some of the organs of the system include the kidneys, renal pelvis, ureters, bladder, and urethra. This system filters the food you consume, which after you consume filters through the kidneys and exits through the urethra, and it takes all the bad things out of your body. What is renal cancer? Firstly, renal means relating to the kidneys, and cancer means cells that grow out of control. And one of the most common types of renal cancer is renal cell carcinoma, and it forms in the lining of very small tubes in the kidney. Another well-known but not as common type of renal cancer is transitional cell carcinoma, and very young children can get something called Wilms tumor, which is a type of kidney cancer, and only very young children get it. The stages of renal cancer are 4 distinct stages, and as we see an increase in stage, we see that this is proportional with an increase in tumor size, an increase in area affected, and a decrease of survival rate. We see to the right in the picture that stage 1 is a tumor of less than 7 centimeters, limited to the kidney, and has a 5-year survival rate of 95%. Stage 2 is a tumor that is grown greater than 7 centimeters, still limited to the kidney, and a decreased 5-year survival rate of 88%. Stage 3 is a tumor in major veins or adrenal gland, or a tumor within Gerarda's fascia, or one regional lymph node. And we see the 5-year survival rate decrease again to 59%. And as stage 4, we see a tumor that goes beyond Gerarda's fascia or beyond one lymph node, and we see the 5-year survival rate decrease to 20%. Some symptoms of renal cancer are blood in the urine, a lump in your abdomen, loss of appetite, weight loss for unknown reasons, fatigue, and pain in your side, abdomen, or back for no known reason, and it is dull and might not go away. And with the weight loss, if you are not exercising but you're still losing weight every day, that is also a symptom. Causes/risk factors for renal cancer is smoking, obesity, older age, high blood pressure, a family history of kidney cancer, exposure to certain substances in the workplace, certain inherited syndromes like von Hippel-Lindau disease, Birt-Hogg-Dubé syndrome, or tuberous sclerosis complex. How to diagnose renal cancer? Some diagnoses can come from a physical exam and history with your doctor, and an ultrasound exam, a blood chemistry study, a urinalysis, a CT/CAT scan, an MRI or biopsy. These are all performed by your doctor, and you might see a specialist called a urologist, who is a surgeon that specializes in treating diseases of the urinary system and reproductive systems. Some treatments for renal cancer are active surveillance, which is you and your doctor watching the growth and your symptoms progress with your tumor, a renal tumor ablation, surgery, chemotherapy, radiation, or a clinical trial, which is a type of a new treatment that is on trial that you could participate in. To the right, we see a partial nephrectomy, which is a surgery that removes part of the kidney that has the tumor. And some preventions that you can take to reduce the risk of kidney cancer is quitting smoking, maintaining a healthy weight, controlling your high blood pressure, finding out if you're exposed to certain toxic chemicals at home or at work, and be aware of certain risk factors such as family history, of renal cancer and certain inherited diseases. These are my references, and thank you so much for listening.